China might not be reporting any recent COVID deaths, but frustrated crowds at this funeral parlour in Jinan City tell a different story. While body bags piled up at this one in Chongqing on Thursday. They join hospitals across the country in being inundated by people.
Work in the emergency department is non-stop. Every day we have been busy from the beginning to the end of the day. There is no break.
Officials say only deaths from pneumonia or respiratory failure are counted in the COVID toll. On Saturday, it was announced the National Health Commission would no longer be publishing COVID numbers at all. Instead, they'll come from the Centre for Disease Control and Prevention. But it's not clear how often they'll be updated. What is clear is that COVID is still surging and straining health facilities.
The hospital is just overwhelmed from top to bottom. So, the ER filled up with people. A lot of them got admitted to the hospital. They're not getting better in a day or two, so there's no flow.
The British-based health data company Airfinity estimated last week that China was seeing more than 1 million infections and 5,000 deaths a day. But the government says the situation is controllable.
China is expanding its production of medical supplies and is generally sufficient. The pandemic prevention and control situation in China is generally predictable and controllable.
In the major cities, there are early signs that people are getting back to business. The trains are getting busier and the traffic jams are back.
I'm on my way to work. Everyone has basically gone back to returning to work. There is no need for us to check the health code when we eat out, and the tense atmosphere has now passed.
But the Lunar New Year, the biggest festival on the Chinese calendar, is just a few weeks away. And with it, the possibility of another spike in infections. Beldi, ABC News.